and welcome to Oceanside Spectrum. For our first guest, we have Renata Smith, Executive Director of the Gary and Mary West PACE, and Dr. Karen Becerra, CEO and Dental Director of the Gary and Mary West Senior Dental Center. Welcome to you both.
Thank you so much.
Yes, so Renata, let's start with you.
Sure.
About this, the Gary and Mary West PACE. What do you do? Why do you do it over there?
Wow. So PACE stands for Program of All-Inclusive Care for the Elderly. And what we do there is we take care of seniors that are low income, that are acutely ill, have chronic illnesses. And what we do is we wrap our services around them so that they could stay in their homes and be productive members of the community rather than living in a skilled nursing facility.
Wow, so I understand. So this Senior Dental Center, which is part of this, you have a new building or?
We have a beautiful building in San Marcos, and we are very fortunate to be co-located in the same building with the Senior Dental Center with Dr. Karen Becerra.
And how long has this particular facility been open? So it's newer, it's not new?
Right.
Or,
We've been open since September. We started serving participants on September 3rd. And we're very happy to be enrolling participants every month now into our program.
Awesome. And Dr. Becerra, so your focus is on senior dental care there. Why the interest? How did you come into this field?
Well, I had an opportunity to volunteer serving meals for seniors. And everybody thinks that as you get older, it's common to lose teeth. But if you don't have teeth, you cannot eat healthier, you cannot speak clearer, you cannot smile. So it makes just sense to me that the mouth is not disconnected from the rest of the body. So I enjoy taking care of seniors and their oral health.
That's awesome. And I understand that you're not the only dentist in the family, is that correct?
That's correct. There's a couple of dentists in my family. My grandpa was a lab technician, so I do enjoy working on dentures and partials, and that's very common in the geriatric or the senior dental population.
Now, are you over both? Because correct me if I'm wrong, Renata, there's a San Marcos location, there's also a location downtown San Diego?
For the dental center, correct.
For the dental center.
Right. The PACE program solely in the San Marcos location.
Okay, and so Dr. Becerra, how has the San Marcos, the newer location, been going?
Well, it's been going really well because what we're doing is we're bringing healthcare to where it's convenient for the patients. In the PACE program, patients are there. We're also serving seniors from the community. We're specialized geriatric dentistry where seniors can come and feel secure that we provide the specific dental care that they need. We practice minimally invasive dentistry. So we understand what the medical, social, mental circumstances of the patients are, and we don't put them through unnecessary stress and trauma that they may not need.
So what are the qualifications to enroll in? Is it affordable or is it free dental assistance?
It could be either.
Okay.
And it's dentistry is just one of the things that we offer in PACE. There's a lot of services that we provide, including transportation, primary care clinic, physical and occupational therapy. And there are 4 ways to qualify. Really, you need to meet 4 criteria to be part of the PACE program. Seniors need to be 55 years or older. They need to live in our designated service area, which is all of North County. We have 32 zip codes. They need to qualify for what's called a skilled nursing home level of care. So we have to send level of care assessments to the state of California to make sure that these folks qualify on a health level, that they are chronically ill enough to be part of the program. And the 4th qualification is with our services wrapped around them, they should be able to stay safely in their communities. So 90% of the folks that qualify for PACE and enroll in PACE end up not going to an institutional setting. They end up staying at the PACE program.
And that's awesome, because I also understand, and correct me if I'm wrong, because don't you also offer transportation to and from at least certainly the dental center? Yeah. Oh, okay.
Yes, we pick up participants from their homes and we bring them to the center. Some come to the adult daycare center 2 times a week, some come 3 times a week. It depends on their needs. So our program is very much based on person-centered care. So we will evaluate each individual participant on their own merit, and if there's a medical need, we fill it.
That's wonderful. And Dr. Becerra, I know you said that you got in this work, you had a passion for it. Is there, and I know I'm putting you on the spot, is there a story, like a little bit of tidbit that was like, this is why I do what I do, since you...
I'm going to tell you a very fast version, but there is.
Yes.
I was on a single engine airplane that fell mid-air. And I thought I saw what was the last minutes of my life. And I know what I thought at that time. It didn't matter how much money, it didn't matter how many accomplishments. The only thing that mattered was what I was leaving behind. When I landed and I saw that I didn't die, I decided I wanted to be part of something bigger than just my own private practice. And I was very fortunate to get the support of Gary and Mary West Foundation, and I was able to create this clinic. So that's the story behind it.
That is a awesome, wonderful story. And Renata, real quick here, because we've got a little bit under a minute. How can someone become involved, whether a patient or to donate? How does that happen?
Absolutely. So anybody can call us at the Gary Mary West Pace Center. I believe the numbers will be on screen,
Yes,
but
they
it's
will.
760-280-2230. Any one of our staff would be more than helpful and willing to share the program benefits and take it from there. It could take up to about a month to enroll. And then they can also call the dental center separately.
And anyone qualifies, so we provide different dental services. We have contracts with different insurances. So, and our team has a very gentle and kind approach, and we make sure that our seniors feel comfortable with the care we provide for them.
Thank you, Dr. Becerra, Renata Smith,
Thank
for
you.
joining us. And like she said, if you want to learn more about this wonderful opportunity, please call any of the websites and numbers right there on your screen.